How diabetes affects sexual health, scientific explanation and research findings. Diabetes is a long-term metabolic disorder that not only increases blood sugar levels but also gradually damages various essential systems in the body. Its effects extend to the heart, kidneys, eyes, nerves, and even sexual health. Today, we will explore how diabetes impacts sexual health in both men and women, based on scientific explanations and research findings. First, let's understand what is needed for healthy sexual function. Normal sexual health requires proper blood flow, a healthy nervous system, hormonal balance, and mental well-being. Diabetes affects each of these areas in some way. Vascular damage is a major problem in diabetes. Prolonged high blood sugar levels damage the inner lining of blood vessels, known as the endothelium. This reduces the production of an important chemical called nitric oxide. Nitric oxide helps dilate blood vessels and increases blood flow to the penis or sexual organs during arousal. When nitric oxide levels are low, sufficient blood flow does not occur, leading to reduced sexual performance. Research has shown that men with diabetes are 2 to 3 times more likely to experience erectile dysfunction compared to their general population. In many cases, this issue begins even before diabetes is formally diagnosed, serving as an early warning sign. Another major effect of diabetes is on the nervous system. Long-term uncontrolled diabetes can cause diabetic neuropathy, which prevents sexual arousal signals from properly reaching the sexual organs from the brain. As a result, sexual sensation decreases, arousal is delayed, or maintaining an erection becomes difficult. Scientific studies have found that individuals with diabetes experience reduced sexual sensation and weaker arousal responses. This is true not only for men but also for women. Hormones are also significantly affected by diabetes. In particular, type 2 diabetes can lower testosterone levels. Testosterone is a crucial hormone for sexual desire, strength, and performance. When testosterone levels decrease, sexual interest declines, fatigue increases, and self-confidence suffers. Studies have found that about 30 to 40% of men with type 2 diabetes have lower than normal testosterone levels. This further complicates sexual problems. Mental health is equally important. Diabetes is a chronic condition that often causes stress, anxiety, and depression. Mental stress directly reduces sexual desire and performance. Elevated levels of the stress hormone cortisol negatively impact sexual hormones. Research shows that diabetic patients experiencing depression or long-term stress have a significantly higher rate of sexual problems. Now let's discuss the impact on women. Sexual problems are often perceived as a male issue, but diabetes deeply affects women's sexual health as well. Diabetes reduces blood flow to the vagina, causing vaginal dryness, decreased arousal, and discomfort during intercourse. Studies have found that women with diabetes often experience reduced sexual desire, decreased satisfaction, and discomfort during intercourse. Nerve damage can also reduce normal sexual sensation. So, does having diabetes make a healthy sexual life impossible? The answer is no. With proper management, a healthy sexual life is possible even with diabetes. Scientific evidence shows that keeping blood sugar levels under control can significantly reduce vascular and nerve damage. Regular exercise improves blood flow, enhances insulin sensitivity, and supports nitric oxide function. A healthy diet, adequate sleep, and stress management are also crucial for sexual health. Following a doctor's advice regarding medications or hormone evaluation can further improve the situation. This is why sexual problems in diabetic patients should not be hidden but addressed as a medical and scientifically explainable issue. Many people avoid discussing these matters due to shame or misconceptions, which can worsen the problem. Research indicates that individuals who maintain good diabetes control and adopt positive lifestyle changes experience noticeable improvement in sexual health. Controlled blood sugar levels slow nerve and vascular damage, helping maintain sexual function. Another important point is that sexual problems can sometimes serve as an early warning for heart disease. The blood vessels in the penis or sexual organs are smaller than those in other parts of the body, so blood flow problems appear here first. Studies show that men with diabetes who experience erectile dysfunction have an increased risk of future heart disease. For this reason, medical science no longer considers sexual problems in isolation. They are now viewed as an important indicator of overall health, along with controlling diabetes. Certain lifestyle changes are particularly beneficial for sexual health. Regular walking or light exercise improves circulation and supports hormonal balance. Losing excess weight can enhance testosterone levels, which boosts sexual desire and energy. Smoking and excessive alcohol consumption worsen the harmful effects of diabetes. Studies have shown that smoking constricts blood vessels and reduces nitric oxide function, which is highly detrimental to sexual health. Mental health is equally important. Long-term stress, fear, or lack of confidence further complicates sexual issues. Research has shown that counseling or psychological support can improve sexual life quality for diabetic patients. In conclusion, diabetes and sexual health are deeply interconnected. This is not a sign of weakness, failure, or loss of masculinity. It is a normal medical reality supported by science and research. Diabetes can affect nerves, blood flow, hormones, and mental well-being, all of which play a vital role in sexual health. Understanding this connection removes unnecessary fear, guilt, and stigma. The good news is that diabetes does not mean the end of a healthy or satisfying sexual life. With proper blood sugar control, a balanced lifestyle, regular physical activity, stress management, and timely medical guidance, most sexual health challenges related to diabetes can be improved or even reversed. Modern medicine, lifestyle changes, and psychological support together offer real and effective solutions. Awareness is the first step. Early diagnosis, open communication with healthcare professionals, and honest conversations with your partner can make a powerful difference. Ignoring the problem only worsens it, but addressing it with knowledge and confidence leads to better outcomes, not only sexually, but for overall health and quality of life. Remember, living with diabetes is about management, not limitation. When diabetes is controlled, life can be full, active, confident, and intimate. Knowing the truth, accepting the science, and taking informed action are the most important steps toward a healthier body, a stronger mind, and a more satisfying life. Thank you so much for watching this video till the end. If you enjoyed this video, please give it a like, share it, and follow or subscribe to our page and channel for more informative videos. Also, don't forget to comment below and let us know your thoughts or questions.